Hello, my name is Suzanne Mumford and I'm Head of Nursing Care and Dementia at Care UK. I predominantly look after anything to do with clinical care or dementia. So my responsibility is keeping people safe, keeping people comfortable and helping our teams to be well educated. So one of the things that we find a challenge within the care sector is helping colleagues to actually assess pain. It can be seen as an unnecessary burden, tends to be done by paper, can be quite time consuming, and also colleagues don't always think that people are in pain. If they can't communicate their needs anymore, then they tend to think that they're not in pain. And we know that quite a lot of the behaviours that we see, particularly from people with dementia, but not all people with dementia, are linked to pain as a result of pain that they can't articulate. So that was a challenge for us, and it remains a challenge for us across the industry to actually identify who's in pain and how we manage that. So we've been using PainCheck in a number of our homes for several years now. We initially did a pilot in Suffolk, and we identified that the more pain assessments that we did, the less distressed behaviours we saw, the fewer antipsychotics we used, and we predominantly brought it into those homes to see if we could reduce antipsychotic prescribing. What we've seen across all of the homes that are using PainCheck is a reduction in falls, a reduction in distress behaviours, better compliance around personal care, particularly for those people who tended to be resistive to care, fewer hospital admissions, and early identification of infections and things that might cause that person to go into hospital. We've also seen carers being much more confident to be able to say to a GP or to a nurse practitioner, actually this person's in pain. Their behaviour is because they're in pain and they need effective pain relief. I think that there are quite a lot of stories that we can tell around people who have had quality of life improved by having regular pain relief. I was talking to one of our managers this morning and she said she had one lady who came into her care home who was in terrible pain, couldn't settle, kept trying to climb out of bed, kept having falls. And by using PainCheck, by using effective pain assessment, this lady was put onto regular pain relief. Initially that didn't quite work, it wasn't strong enough, and now she's on a patch and she's settled, she's comfortable, she's involved in life within the home, she's not falling, she's not trying to get out of bed. But additional to that is how her husband feels. He feels now that he can leave her at the end of the day and that she's in safe hands, that she's comfortable, she's relaxed, and that's made an enormous difference to his life as well as hers. So one of the things that we've noticed by using PainCheck, particularly in relation to identification of infections, is that when somebody is starting, they're brewing an infection, they tend to behave slightly differently and they may well have pain at that time. If we think about somebody who perhaps has a urinary tract infection, anybody that's had a urinary tract infection knows that it's uncomfortable and can be excruciatingly painful. If we can nip that in the bud early by identifying that the person's starting to get a little bit uncomfortable and that they may need treatment, then we can give that evidence to the GP and get treatment for them earlier. Clearly there's an element of how do we prevent that in the first place. But what we have found is that people who are treated well for their pain, and I think also about respiratory infections, we all know that if we keep on having a hacking cough, then it's likely to cause us a lot of pain. But it also becomes a cycle where you're coughing and coughing and coughing and it hurts. I mean, you know that you shouldn't be coughing, but you need to cough. Then treating that pain that's caused by the coughing will actually help that person to settle better and help them to fight the infection better. So I think it's a side part of using PainCheck that we hadn't anticipated, that we would be able to identify the symptoms of infection much earlier, treat those infections, and therefore improve the quality of people's lives. Working with PainCheck has been a delight. It's an an insightful dashboard. We get a lot of information. We can see at a glance from an organisational, operational level exactly what's going on in our homes in relation to improvement of service. But we also know that it's just a phone call away to actually say to the team at PaintCheck, we need a little bit of help, we need a bit more training, we need a bit more support. We're not quite sure what's going on here. Could you offer the team a little bit more support? I was talking to one of our home managers and she was saying, I know I can pick up the phone. I know I can get in touch with them, and I know that I'll always get a response that says I can help you. So we've been absolutely delighted working with PaintCheck, and I think if other organisations are thinking about doing this, it's not only good for your residents, it's good for your team, it's good for your organisation, and it's good for the operational side of working with older people.